Good day everyone, this is Anwar as Trainer. So I'll be performing lumbar puncture. So lumbar puncture is inserting a steering needle into a subarachnoid space in the spinal cord to detect if there is a blood in the CSF, to administer intracranial medication to provide anesthesia and sensation. Okay, so the first procedure is determine whether written consent for the procedure has been obtained to prevent potential error. Okay, so assuming that I've already checked, explain the procedure to the patient and describe the sensation that they are likely during the procedure. For instance, sensation of cold as the site is cleansed with a solution. A needle prick when the local anesthesia is injected to gain patient's cooperation and reduce anxiety. Okay, sir, so I'll be recording your observations. Assuming that you will feel discomfort in your spinal cord. Okay, determine whether the patient has any questions or misconceptions about the procedure. Reassure the patient that the needle will not enter the spinal cord or cause paralysis. To ensure that the PT has no doubt in regard to the procedure. So, sir, do you have any questions regarding the procedure? Do you have this? Thank you so much. Instruct the patients to void before the procedure to promote comfort during the procedure. So, sir, can you void? Cannot. Okay, during procedure, the patient is positioned on the side of the edge of the bed or examinee. Position allows easier needle insertion into a subarachnoid space of the spinal, and because this position widens the space between the lumbar puncture. Okay, a table with back toward the physician. The thighs and legs are flexed as much as possible. A small pillow may be placed under the patient's head. Maintain the spine in a horizontal position. A pillow may be placed between the legs. This is the movement of the PT could produce a trauma to the spinal cord area. Next, the nurse assists the patient to maintain the position, prevent trauma to the signal cord area. The patient is encouraged to relapse and is instructed to breathe normally. This may interfere in the pressure reacting. The nurse describes the procedure step by step to the patient as it proceeds to alleviate anxiety. The physician cleanses the puncture site with an antiseptic solution which treats the site to prevent the spread of microorganisms. Assuming that I've already cleansed this part, the physician injected the local anesthesia. Okay, next, the physician applies a small dressing to the puncture site, protect the puncture site from dressing to the puncture site. The tubes of CSF are sent to the laboratory immediately to process the laboratory technologies. For the pulse procedure, instruct the patient to lie prone for 2 to 3 hours to separate the alignment of the pleural and needle puncture in then monitor the patient for the complications of the lumbar puncture. Notify physician if complication occurs. This is established based on data. Then encourage increased fluid intake to reduce risk of complications.